Hello everyone, welcome to Nursing Tutorials with Jamila. Today we are going to be looking at insertion of Jadelle. Now in the insertion of Jadelle, I have a list of some of the requirements I need. Now this is my arm model. So I'll be using this arm model for the insertion. Then I need the Jadelle. The Jadelle, you can see it. Okay. I need the TROCAR. Now this is the TROCAR for the insertion of Jadelle. Then I need 2 to 4 mils of xylocaine, which we can use to anesthetize the area for the insertion. Then we also need a gauze soaked in an antiseptic. Okay, so we're going to be using this. And then I have my artery faucet. Then of course sterile gloves. So now in the insertion of Jadelle, it is usually done after the counseling section. So the first thing you're supposed to do is to make the client comfortable in a lying position. The client lie on a dorsal position, and then the arm for the insertion of the Jadelle is extended. So this is the arm that we're going to use. Now the insertion is usually done at the inner aspect of the arm. You can see this is the inner aspect of the arm, and then this is the outer aspect of the arm. So you take your measurement for the insertion. Now it's usually 6 to 8 centimeters away from the elbow joint. So I'm going to use my fingers for this. So I have my pen that I will use to mark the sides so that I don't miss the measurement. Okay, you can see that. So from here to this place, you can estimate it to be 6 to 8 centimeters. Okay, now the next thing to do is to clean the side. So you pick your gauze that is soaked in an antiseptic solution. You clean the side for the insertion. Okay, you go in a circular motion, and then you discard. So you allow the side to air dry. While you are waiting, you should have your gauze, your sterile gauze, and then you should empty the Jadelle. It's usually 2 rows, so you don't touch the inner aspect of the pack of the Jadelle. You place it on the sterile gauze. Alright, so you can see I have 2 rows of Jadelle on the sterile gauze. And then this is my TROCAR for the insertion. So you also place it on the sterile gauze. Then you go ahead and put on your gloves. So now the area is dry. We can see that the antiseptic is already dry. So we're going to place your drape, your sterile drape, you place it over the area. So this is it. Now you can see that I'm only exposing the sides of the insertion. So you place it over the area. Okay. The next thing to do is to anesthetize the area. So since it is subdermal, you're going to introduce your needle, okay, at the site where you want to insert the Jadelle. Okay, so you go down and then you introduce. Then as you're coming out, you are also alright. So I'm also going to go this direction because I'm going to place the roots in a V direction. Alright. So I'm coming out, I'm introducing the xylocaine injection. So before it comes out, you make sure you introduce all of it. Then you discard in the injection box. Alright, so you pick the trocar. You pick the trocar, you can see that it is covered with a rubber, so you remove the cover. Now looking at the trocar, you can see that it has 2 marks. So you don't touch the side of the introduction with your hand, or the portion that you're going to introduce into the arm. You don't touch it with your finger. You can see that it has 2 marks. There's a mark that is very close to the handle, you can see that. Then there's another one that is close to the tip of the trocar. So now the importance of these 2 marks is that when you are introducing, you introduce the trocar as far as to this mark that is closer to the handle into the tissue. Alright, so then the mark at the tip, when you are removing, in order to change the direction for the second insertion of the second rod, you make sure you withdraw the trocar to the level of this mark that is at the tip. Alright, so we are going to see this one step by step. Okay, so this is it. So I'm going to start inserting the trocar. Okay, now this is the trocar, the whole of it. Then we have a plunger inside this. Okay, this is what we call the plunger. We use it for introduction of the rod. So we are going, you can see that I'm going to place this at the side that I've already marked. Wow, this is a little bit tall. So as you are introducing, you'll be tenting the skin. Alright, that is, you'll be pulling and then upward and downward direction. Alright, so you can see that I stop pushing the trocar once it's reached the sides, the marked side. So I'm going to withdraw the plunger now. Okay, I will use my stereo hand. Now you can use your glove hand. You can use your glove hand or tweezer to pick the rod. Okay, then you gently insert it. Alright, I'm going to use this plunger to push it in. Now in pushing the plunger, the rod, you push gently and you make sure that when you feel a resistance, you don't continue pushing. Okay, so I'm feeling a resistance, so you can see there's a resistance, so I will not continue pushing. Then in that I will withdraw the trocar until that mark end, the mark that is very close to the tip is seen. Okay, I'll continue to withdraw. Alright, now you can see I can see that mark, so I'm going to change direction. Okay, the V direction, and then I'll go the same way. Alright, I'll be tenting, keep on tenting the trocar until the mark is reached. You can see that. Alright, so I'll do the same thing. I'll withdraw the plunger now, and then I'll pick the second rod and then I'll insert it inside. Okay, can we see that? So you gently push, and once you feel a resistance, you stop pushing. Okay, so there's a resistance now, so I'll stop pushing the plunger. In the same way, I'll continue to withdraw. I'll withdraw the trocar as a whole. So this time around, I'm going to completely withdraw it because I've finished introducing the 2 rods. Okay. Wow, you can see. After successfully removing the trocar, you discard it into injection safety box. Then you apply dressing, sterile dressing to the side so that it will not be gushing of blood. So you apply dressing on the side. Usually some use a gauze and a plaster, but you can also tie the arm. Okay, you can also use gauze to tie the arm. Okay, with a mild pressure, this will reduce the gush of blood. Okay, then you make the client comfortable and then you record everything. For more videos, you can subscribe for our channel and also don't forget to hit the like button.